Sound Ergonomics has partnered with Oakworks to create an ultrasound exam table line that is both ergonomic and flexible enough to meet the needs of a variety of different ultrasound departments and work styles. Now we'll talk about the individual specialty exam tables. The first one that we'll look at is the vascular table. This table is used for scanning carotid arteries, arm and leg arteries and veins. It can be put into reverse Trendelenburg up to 40 degrees, and if you add the Fowler component, it can go to 70 degrees. This is an important feature for doing venous reflux studies of the lower extremity. Notice that we have a split footboard. The advantage of that is to allow for weight-bearing and non-weight-bearing studies, which we will demonstrate in a moment. For a 70 degrees reverse Trendelenburg, the patient should be strapped with this little seat belt in order to provide security. And now we can get up to 70 degrees tilt for the venous reflux studies. The vascular table has split footboards to allow the sonographers to do weight-bearing and non-weight-bearing studies. You can have the patient standing on the footboard, or the footboard can be dropped away so that one leg is completely without any weight-bearing. The other option is to have it drop a notch down so that it's a little bit below the other footboard, but is still in a position where the patient, should he or she need to have foot support, has access to it. By raising the exam table while it's in this reverse Trendelenburg position, I can now scan the patient's legs without reaching or bending my back or trunk. So I can access the legs, and then when I'm ready to scan this side, I can access the left leg without having to bend or twist or without excess arm abduction. So this is the advantage of having the height adjustability and the table tilt. An additional optional feature that can be added to the vascular table is an arm board. This is added by using a T-rail adapter, and it allows you to scan the patient's arm to get close and to reach the entire extremity. It can be positioned in multiple positions in order to have access to the entire arm. Another optional feature for the vascular table is the headrest. This allows you to have access to the patient's carotid arteries and still have support for the scanning arm. This is also a feature that can be added to a multi-specialty table for scanning the thyroids. All ergonomic tables should be electrically controlled. This allows for quick, easy, and small adjustments while you're doing your exams. These tables all come with a hand control that controls the Trendelenburg, reverse Trendelenburg, Fowler, height, and other special features unique to certain exam tables. In addition, the tables also have the capability of being controlled with a foot control. All of the exam tables come with individual locking casters. Some of the exam tables have the option of adding a central locking caster where all four wheels can be locked with one device. Another option is side rails. They can be added to any table, and they're easy to operate and swing down out of the way so that they do not increase the distance between the sonographer and the patient. The height range of this table is variable enough to allow for different scanning positions. I can scan comfortably seated with a very low height that also allows easy access for the patients. Or if I choose to stand or have a need to stand, the height range is enough to allow me to keep my arm close to my body and reduce arm abduction and possible shoulder injuries. This height is also valuable for doing procedures and biopsies, because often the physician will want to have it high enough to be able to reach the patient. With the low end of the height range at 22 inches, it allows for easy access for patients transferring from wheelchairs. A standard feature on all the exam tables is a paper roll holder. This can actually be removed, and the brackets that hold the bar can be folded back against the tabletop. This allows sonographers to come in under the tabletop without obstruction to their knees. if they're scanning from the head of the table. Hello, I'm Carolyn Coffin. I've been a clinical sonographer and an ultrasound educator for over 20 years. I'm also an ergonomics consultant with a company called Sound Ergonomics. Sound Ergonomics focuses on occupational injury with a particular interest in diagnostic imaging and ultrasound. We offer educational products and services, workplace evaluations, and equipment design consultation in the hopes of helping to reduce the injury risk to sonographers and sonography professionals.